Hello and good morning. It's the lab chick again, and I hope you've had a wonderful week. Mine was good. So today we would like to talk about yeast infections, also known as yeast vaginitis or candidal vaginitis. Now, I'm sure you've heard that someone has a yeast infection, or maybe it was you who had a yeast infection. But what really causes a yeast infection? What are its symptoms? How can it be prevented? And who are at a higher risk of being infected with yeast infection? Can men get yeast infections? I'm sure you'd like to know. So let's get right into the video. Yeast infections are caused by fungi known as Candida albicans. One funny thing about these fungi is that it is found in your body and it is normal to be found there. So, an overgrowth of this candida is what will cause the yeast infection. This overgrowth could be due to an imbalance of the vaginal pH due to hormones. It can be due to taking a lot of antibiotics over a long period of time, wearing damp clothing, and even wearing tight clothing. So, if you're a person who likes wearing tight clothing, you're at a risk of getting a yeast infection. The symptoms of a yeast infection are the classical ones that we know: itching, thick whitish discharge, pain during intercourse and urination, redness or a rash. And men can also be affected by yeast infection. In men, this infection is known as the penile yeast infection, meaning that it affects the penile area. So it is caused by having unprotected sex. So men can prevent themselves from getting this yeast infection by wearing a condom and regularly bathing after sexual intercourse. The symptoms are just the same as those in females, which includes itchiness, redness, and a rash, specifically in the penile area. Now, you're wondering who is at a risk of getting a yeast infection. If you're sexually active, you're definitely at a risk of getting a yeast infection. Therefore, it is important to use protection during sexual intercourse. People who are diabetic are at a risk of getting this yeast infection because in diabetes there's an elevated sugar levels, and elevated sugar levels and yeast infections they kind of go hand in hand. Anywhere where there is sugar, there's definitely going to be yeast infection. So people who are diabetic are at a risk of getting a yeast infection. People who are pregnant are also at a risk of getting infection because during pregnancy there are a lot of hormonal changes. The hormones are at increased levels, thereby changing the pH of the vaginal area. So those are the people who are at a risk of getting a yeast infection. Yeast infections are diagnosed in the laboratory in two ways. So, as a laboratory person, as myself, what we will do is that we'll request you to bring a urine sample. Then we will take your urine sample and examine it under a microscope. Under the microscope, if we are able to detect the presence of yeast cells, then you definitely have a yeast infection. Or if we culture your urine and we can be able to isolate Candida albicans as a fungi, then you definitely have a yeast infection. Also, in other cases, a pelvic exam can be done by a gynecologist, and in the pelvic exam, the gynecologist will try to look for presence of thick whitish discharge, thereby indicating that someone has a yeast infection, and that is how we diagnose yeast infections. How can you prevent yourself from getting a yeast infection? It is very simple. The first thing that you can do is to wear cotton or silk underwear, as these kinds of fabrics will enable you to absorb excess moisture that comes through sweating, especially in your private parts. Number two, what you can do instead of airing your underwear inside the house, it's important that you air them outside in the sun, as the sun will dry all the moisture from your underwear. So don't be afraid to air your underwear outside. Another thing that you can do is to avoid douching and using highly sensitive female hygiene products. This is because there's one important thing that you have to know is that God created your body in a very unique way. And did you know that your vagina cleanses itself? So there's no need to use these highly sensitive products. You can just use water to cleanse your vagina and you're all good, because the vagina will definitely clean itself. Finally, How can you treat a yeast infection, assuming that you have a yeast infection? What you can use are antifungal creams or suppositories or pessaries. Suppositories are those drugs that are applied over the skin, while pessaries are those that are inserted, especially in the vaginal canal. So the most common ones that are used here in Kenya are clotrimazole and fluconazole. So the men are most likely to use the suppositories, as they will apply these over the penile area, while the ladies will use the pessaries as they will insert them in the vaginal canal. So those are the most common ones used, but what you need to do is to ensure that you get a prescription from your doctor. And that is what we had for today. It was a brief short video, and I hope it has been quite informative for you. So if you haven't subscribed, now is the opportunity. Hit the red button. There is more informative videos coming right up. And in our next video, I'm sure you're wondering, what are we going to talk about next? How about I give you a hint? We're going to talk about asthma. So stay tuned in, subscribe, and you'll get to know this. So have a wonderful day.